A stroke is a medical condition in which poor blood flow to the brain causes cell death. There are two main types of stroke: ischemic, due to lack of blood flow, and hemorrhagic, due to bleeding. Both cause parts of the brain to stop functioning properly. Signs and symptoms of a stroke may include an inability to move or feel on one side of the body, problems understanding or speaking, dizziness, or loss of vision to one side. Signs and symptoms often appear soon after the stroke has occurred. If symptoms last less than 1 or 2 hours, the stroke is a transient ischemic attack, TIA, also called a mini-stroke. A hemorrhagic stroke may also be associated with a severe headache. The symptoms of a stroke can be permanent. Long-term complications may include pneumonia and loss of bladder control. The main risk factor for stroke is high blood pressure. Other risk factors include high blood cholesterol, tobacco smoking, obesity, diabetes mellitus, a previous TIA, end-stage kidney disease, and atrial fibrillation. An ischemic stroke is typically caused by blockage of a blood vessel, though there are also less common causes. Hemorrhagic stroke is caused by either bleeding directly into the brain or into the space between the brain's membranes. Bleeding may occur due to a ruptured brain aneurysm. Diagnosis is typically based on a physical exam and supported by medical imaging such as a CT scan or MRI scan. A CT scan can rule out bleeding, but may not necessarily rule out ischemia, which early on typically does not show up on a CT scan. Other tests such as an electrocardiogram, ECG, and blood tests are done to determine risk factors and rule out other possible causes. Low blood sugar may cause similar symptoms. Stroke symptoms typically start suddenly, over seconds to minutes, and in most cases do not progress further. The symptoms depend on the area of the brain affected. The more extensive the area of the brain affected, the more functions that are likely to be lost. Some forms of stroke can cause additional symptoms. For example, in intracranial hemorrhage, the affected area may compress other structures. Most forms of stroke are not associated with a headache, apart from subarachnoid hemorrhage and cerebral venous thrombosis and occasionally intracerebral hemorrhage. Causes. In most cases, the symptoms affect only one side of the body, unilateral. Depending on the part of the brain affected, the defect in the brain is usually on the opposite side of the body. However, since these pathways also travel in the spinal cord and any lesion there can also produce these symptoms, the presence of any one of these symptoms does not necessarily indicate a stroke. In addition to the above CNS pathways, the brainstem gives rise to most of the 12 cranial nerves. A brainstem stroke affecting the brainstem and brain, therefore, can produce symptoms relating to deficits in these cranial nerves. Altered smell, taste, hearing, or vision, total or partial. Drooping of eyelid, ptosis, and weakness of ocular muscles. Decreased reflexes. Gag, swallow, pupil reactivity to light. Decreased sensation and muscle weakness of the face. Balance problems and nystagmus. Altered breathing and heart rate. Weakness in sternocleidomastoid muscle with inability to turn head to one side. Weakness in tongue. Inability to stick out the tongue or move it from side to side. If the cerebral cortex is involved, the CNS pathways can again be affected, but also can produce the following symptoms. Aphasia, difficulty with verbal expression, auditory comprehension, reading and writing. Broca's or Wernicke's area typically involved. Dysarthria, motor speech disorder resulting from neurological injury. Apraxia, altered voluntary movements. Visual field defect. Memory deficits, involvement of temporal lobe. Hemineglect, involvement of parietal lobe. Disorganized thinking, confusion, hypersexual gestures, with involvement of frontal lobe. Lack of insight of his or her, usually stroke-related, disability. If the cerebellum is involved, ataxia might be present, and this includes altered walking gait, altered movement coordination, vertigo and/or disequilibrium. Associated symptoms. Loss of consciousness, headache, and vomiting usually occur more often in hemorrhagic stroke than in thrombosis because of the increased intracranial pressure from the leaking blood compressing the brain. If symptoms are maximal at onset, the cause is more likely to be a subarachnoid hemorrhage or an embolic stroke. In thrombotic stroke, a thrombus, blood clot, usually forms around atherosclerotic plaques. Since blockage of the artery is gradual, onset of symptomatic thrombotic strokes is slower than that of a hemorrhagic stroke. A thrombus itself, even if it does not completely block the blood vessel, can lead to an embolic stroke, see below, if the thrombus breaks off and travels in the bloodstream, at which point it is called an embolus. Sickle cell anemia, which can cause blood cells to clump up and block blood vessels, can also lead to stroke. A stroke is the second leading cause of death in people under 20 with sickle cell anemia. Air pollution may also increase stroke risk. Embolic stroke. An embolic stroke refers to an arterial embolism, a blockage of an artery, by an embolus, a traveling particle or debris in the arterial bloodstream originating from elsewhere. An embolus is most frequently a thrombus, but it can also be a number of other substances including fat, e.g., from bone marrow in a broken bone, air, cancer cells or clumps of bacteria, usually from infectious endocarditis. Because an embolus arises from elsewhere, local therapy solves the problem only temporarily. Thus, the source of the embolus must be identified. Because the embolic blockage is sudden in onset, symptoms usually are maximal at the start. Also, symptoms may be transient as the embolus is partially resorbed and moves to a different location or dissipates altogether. Emboli most commonly arise from the heart, especially in atrial fibrillation, but may originate from elsewhere in the arterial tree. In paradoxical embolism, a deep vein thrombosis embolizes through an atrial or ventricular septal defect in the heart into the brain. Cerebral hypoperfusion. Cerebral hypoperfusion is the reduction of blood flow to all parts of the brain. The reduction could be to a particular part of the brain depending on the cause. It is most commonly due to heart failure from cardiac arrest or arrhythmias, or from reduced cardiac output as a result of myocardial infarction, pulmonary embolism, pericardial effusion, or bleeding. Citation needed. Hypoxemia, low blood oxygen content, may precipitate the hypoperfusion. Because the reduction in blood flow is global, all parts of the brain may be affected, especially vulnerable, watershed, areas, border zone regions supplied by the major cerebral arteries. A watershed stroke refers to the condition when the blood supply to these areas is compromised. Blood flow to these areas does not necessarily stop, but instead it may lessen to the point where brain damage can occur. Silent stroke. A silent stroke is a stroke that does not have any outward symptoms, and people are typically unaware they have had a stroke. Despite not causing identifiable symptoms, a silent stroke still damages the brain and places the person at increased risk for both transient ischemic attack and major stroke in the future. Conversely, those who have had a major stroke are also at risk of having silent strokes. Silent strokes typically cause lesions which are detected via the use of neuroimaging such as MRI. Silent strokes are estimated to occur at 5 times the rate of symptomatic strokes. The risk of silent stroke increases with age, but may also affect younger adults and children, especially those with acute anemia. Prevention. Given the disease burden of strokes, prevention is an important public health concern. Primary prevention is less effective than secondary prevention, as judged by the number needed to treat to prevent 1 stroke per year. Recent guidelines detail the evidence for primary prevention in stroke. In those who are otherwise healthy, aspirin does not appear beneficial and thus is not recommended. In people who have had a myocardial infarction or those with a high cardiovascular risk, it provides some protection against a first stroke. In those who have previously had a stroke, treatment with medication such as aspirin, clopidogrel, and dipyridamole may be beneficial. The U.S. Preventive Services Task Force, USPSTF, recommends against screening for carotid artery stenosis in those without symptoms.